More than 20 million people in the United States live in areas that have a shortage of physicians to meet their basic healthcare needs. This lack of access to quality healthcare for many people, particularly those living in rural and urban underserved communities, is a serious healthcare problem.
The way it affects the patients is quite severe in that they don't have the access to medical care that others do in metropolitan areas. And it's unfortunate. They have access to some medical care, but you won't get access to the tertiary kind of care, specialists in general, especially. And in order to get that, they have to travel sometimes hundreds of miles.
During this period of rapid changes to healthcare delivery, the demand for rural physicians remains high. Small towns around the country face the loss of their medical services because they have no doctors to run their clinics. Many factors have contributed to the disappearance of the country doctor.
Most states are dealing with this problem. And there's a lot of reasons for that. Some of them are issues of a person's professional life where they choose to work in a bigger group and have the protection and the support of a bigger group. Some of it is just that more and more people in our culture are moving out of rural America and into the more urban centers.
Almost 1 in 3 adults living in rural America is in poor to fair health. Nearly half have at least one major chronic illness, yet rural residents average fewer physician contacts per year than those in urban communities.
The trick really is to get more physicians to come into rural communities, and you have to set up an environment where a person is going to be attracted to that community. A place where somebody is going to be proud to work, a place where they're going to have the support that they need to practice their trade.
Some real specific reasons why physicians would come to a rural community is the lack of managed care penetration in a small community. It's real important to the physicians that they have a funding source for the patients that they're serving, and this makes it very attractive. Another reason to come to a small town is the litigiousness of the nature of healthcare now. In smaller communities, there's much deeper relationships with your patients, and the litigiousness is much lower.
Dr. George Colmia has been treating the heart disease of citizens of eastern Oklahoma, and specifically the 2nd U.S. Congressional District, for more than 20 years. According to research, the 2nd U.S. Congressional District has the nation's highest incidence of cardiac-related deaths per 100,000 people. Additionally, Oklahoma has the highest percentage of Native Americans in the country.
The high number of Native Americans does impact the overall amount of cardiovascular disease because of the higher rate of diabetes and renal disease, etc. But there are many factors to what makes us the highest in cardiovascular disease.
Convinced that the location is not as important as the quality of care before and after complex medical procedures, Dr. Colmia decided to move closer to his patient base. He approached Brian Woodliff, CEO of Tahlequah City Hospital.
In the initial discussions with Dr. Colmia, we really got excited about a mission to bring excellent care to Tahlequah, to the patients that he was serving. There's quite a burden of heart disease in northeast Oklahoma, and really in understanding that better and understanding that his mission was to really care for that burden, we really had a mutual agreement around that.
Brian Woodliff and I had the same mindset in that to bring a higher level of care, a more tertiary type of care to the people in this community for cardiovascular disease.
Tahlequah City Hospital is an 82-bed municipally owned medical center about 75 miles southeast of Tulsa. Smaller hospitals are typically not regarded by larger facilities as capable of performing complex medical procedures. Northeast Oklahoma Heart Center was founded on the principle that bigger is not always better.
What makes the Northeast Oklahoma Heart Center so unique is its location. It's the smallest community in the state of Oklahoma that has a full-service cardiovascular program. And what else is unique about NOHC is that it has a community that supports it not only during operation hours, but after hours as well.
Having a doctor to go to here in Tahlequah instead of getting around, driving to Tulsa and fighting the traffic and spending a day and sometimes having somebody else to go with me and so forth. I set up now where I go out to see Dr. Comia about every 4 months, and I'm in there and out, and it's a whole lot easier and better for me and everybody in the community, I would think.
The Widowmaker artery had a little blood clot, which they have no idea how it got there or why. But I was saved by the care I got, no question about it. It made a big difference having the heart clinic here. I'm here to talk about it. So it made a big difference in my life and my family's life for me to have that kind of care instantly. I came in, they took care of me, I left and went home. It was wonderful.
Our staff really care for their patients when they see them in the community and when they're at the hospital. So it's really a dichotomy between what happens in a metropolitan area where you're part of a system and here you're really part of a family.
It's a great place to work because of the closeness, the close-knit family type atmosphere that we have within our department, within our hospital, within just the community itself. And you can't find that care everywhere, and it's definitely here at Tahlequah City.
Since opening its doors in July 2005, Northeast Oklahoma Heart Center has performed nearly 1,300 heart catheterizations and over 50 open heart procedures in 2007 alone.
The center has been very successful in that it has increased the number of patients that are treated for cardiovascular disease in this community fourfold. It's also been successful in increasing the number of patients in general that are treated in this community. And that phenomenon is very true because when you bring the level of care up and have a specialty type of care and higher technology, more patients are able to be treated in the rural area.
I attribute most of the success to the relationships that have been developed with the patients that we serve. In particular, George Comia, he brings a great deal of expertise and 20 years of good relationships with the patients of Northeast Oklahoma.
Coming here for me has been great because I love to take care of patients. I love to take care of people. The people are wonderful here. They're very appreciative and they're very not only accepting, but they have been overjoyed and have supported the center immensely.
For more information about Northeast Oklahoma Heart Center, contact them today or visit tch-ok.org.